Hello, I am the orthopedic nurse navigator for joint replacement here at UT Medical Center. Welcome to the anterior total hip replacement discharge class. We will look at information about activity after surgery. Most importantly, make sure you are getting short walks in every hour while you're awake and using your walker every time you get up. Continue range of motion exercises and be mindful of walking on uneven surfaces and walking over door thresholds. Do not sit in low or soft chairs. Do not resume sexual activity until discussed with your surgeon. When lying on your back, do not lift your hips all the way up. Avoid taking large steps with extreme extension. When you are going up steps, remember to step up with the good leg first. When going down steps, go down with the surgery leg first, which would be considered the bad leg. Coughing and deep breathing after surgery is very important to re-expand lungs and help prevent pneumonia. Take 10 slow, deep breaths and cough once an hour while awake. If there is not any issues with breathing, it is okay to stop using the breathing machine on post-op day 10. Antithrombolytic hose or compression stockings should be worn after surgery to help prevent blood clots and swelling. You may remove them for short breaks and then replace them. Please use them for at least 10 days after surgery. Next is information about your surgery site and the surgical bandage. The surgical site bandage will be waterproof and it will stay on till the first post-op appointment with your surgeon, unless your surgeon instructs otherwise. Always wash your hands before touching the surgical bandage or the area around it. You or your caregiver will need to look at the bandage at least twice a day. If there is drainage touching 3 of the 4 edges, please call the surgeon's office to notify them. There may be some spotty drainage on the bandage, and that is okay. If the bandage is saturated, please call the surgeon's office as soon as possible. You can shower 48 hours after surgery. Please have your caregiver nearby the first time you shower as a precaution. Inspect the waterproof dressing after showering to make sure it is still sealed properly. Do not use soap, ointments, or any lotions directly around the waterproof dressing. Remember that swelling and bruising is normal and it will decrease over the next couple weeks. Pain after surgery is expected and will likely be worse somewhere around post-op day 2 or 3. The opioid pain pills are prescribed to help control the pain after surgery. Always take pain medicine as prescribed. You may take less than prescribed. A couple tips would be starting with the lowest dose first or taking a half of a pill first rather than a full pill. Another tip for pain management is to use over-the-counter Tylenol or acetaminophen, which is the generic name. You may wish to add the doses of Tylenol with the opioid pain pill, or you may alternate between the doses of the opioid pain pill. Make sure to not exceed more than 1,000 milligrams of Tylenol at a time, and do not take more than 3,000 milligrams in a 24-hour period. It is helpful to have your caregiver keep a list of medicines, the dosage, and the time of day you are taking them. This will help you keep track of all your medications and prevent accidentally taking too much. Another great pain relief tool is ice. Ice helps reduce pain and swelling after surgery. There are different types of ice packs, and you can use whichever works best for you. The guideline for ice therapy is the ice pack is to be on 20 minutes out of every hour, and then give your incision area and the skin around a chance to warm and circulation to normalize before replacing the ice pack. Keep a clean towel or pillowcase between the ice pack and surgical incision as a barrier. Setting a timer is helpful to maximize ice therapy effectiveness. You will not be able to drive after surgery. You will need permission from the surgeon to resume driving at the appropriate time. Do not drive while taking prescription pain medicine. These are some of the medications you may be given after surgery. Not every person will receive every medication. Some of them are as needed and some are prescribed by the surgeon. If you have questions about any medications you are given, please ask your nurse or reach out to your surgeon's office. Constipation can be a common occurrence after surgery. There are several things you can do to help prevent or treat constipation. Getting up and increasing activity, drinking adequate amounts of water, eating a balanced diet with high-fiber foods, and using over-the-counter stool softeners and laxatives will help if you are constipated. Do not let more than 1 to 3 days pass without having a bowel movement after surgery. If you are having difficulty with constipation, please call the surgeon's office for recommendations, or you can reach out to the orthopedic nurse navigator. Preventing blood clots after surgery is very important. You will be prescribed a blood thinning medication to take after surgery for a specified amount of time by your surgeon. There are several things you can do to help prevent blood clots from forming. First, take your blood thinner medication as prescribed. Then make sure you're getting up and moving. When you are sitting, pump your feet or ankles and stay well hydrated by drinking plenty of fluids that do not contain caffeine. You will want to prevent infection while you are healing from your surgery. Always wash or sanitize your hands before touching any area around or near the surgery site. Monitor your surgical site and the skin around it for any signs or symptoms of infection. If there are pets in the home, do not allow them in the bed where you sleep or to lay near the surgical site. If you need a medication refill, call the surgeon's office during business hours. The surgeon's office will need 48 hours to process the request for refill of medicine. You can plan to call before you run out of medicine. Please call the surgeon's office if you have any urgent problems. Reasons you may need to notify the office would be for a temp greater than 102 or higher for greater than 24 hours, any infectious drainage from your surgical site, a dramatic increase in redness and warmth around the surgical site, new chest congestion, severe calf pain accompanied by increased swelling in legs, pain that is increasing after taking pain medicine, new dizziness or confusion, blood in stool or urine, and if you fall or injure the surgical leg. If current urgent questions arise that cannot wait until regular office hours, the surgeon's office has an answering service and a provider on call. Be prepared to give your name, date of birth, surgeon's name, and date and location of your surgery. The provider on call will get a notification of your question and will give a call back. If you experience any chest pain, trouble breathing, or shortness of breath, call 911 or go to the nearest emergency room. For successful recovery from surgery, make sure to keep all follow-up appointments, take medications as prescribed, and complete physical therapy program. Be active and eat healthy. Thank you from your healthcare team here at UT Medical Center for allowing us to be part of your joint replacement journey.